In this segment, we're going to be talking about a naturally occurring phenomenon known as antibiotic resistance. And Dr. Pam Talley is a medical epidemiologist with the Tennessee Department of Health. Thank you for coming in today.
Pleased to be here.
All right, so this happens, it's a naturally occurring kind of condition, but what has caused it to become such an epidemic, particularly in our fine state of Tennessee? You said we don't rank very well when it comes to this.
Right. So organisms, bacteria, fungi, viruses can change genetically and mutate and develop resistance to antibiotics. And that allows the organisms that have not been killed to multiply and survive. And so the more we use antibiotics, particularly inappropriately or when unnecessary, that allows antibiotic resistance to increase and become more problematic.
And that's where they're just not going to work. The person
Correct.
can really become sicker and sicker, and your choices of how to treat them become more and more limited. Is that the end result?
That's exactly right.
All right, so in Tennessee, you said where do we rank?
So the most recent data from the Centers for Disease Control suggests that Tennessee is 47 out of 51, so the 50 states plus the District of Columbia, in terms of the number of antibiotics prescribed per 1,000 people. And it's significant enough that we are actually 2 times the rate of antibiotic prescriptions compared to some states on the West Coast that are really doing quite well. So we have some significant work to do in Tennessee.
All right, a lot of challenges then for the Department of Health, your job. Okay, why do you think that is? Why does Tennessee have such a problem with this?
Well, I think it's a culture. People perhaps expect an antibiotic when it may not be necessary. We know that physicians report feeling pressure from their patients to prescribe an antibiotic in a situation where it is not helpful.
Maybe they call in, they feel terrible.
Everybody feels miserable when they're sick, or when you have taken time off work to take your child to the doctors when they're sick. And we want a quick fix, but it's important to realize that antibiotics are often not only not a quick fix, but have harmful side effects as well.
All right, so when are they most appropriate?
So they only treat bacterial infections. We know that from recent studies that about 30% of antibiotics that are prescribed in the US, perhaps more in Tennessee, are unnecessary because they're used for viral infections that they don't do any good for. If you have a virus, you've been given an antibiotic and you feel better in 2 days, you think it's great, that was a fantastic antibiotic, when in fact the virus is very likely to have gotten better and made you feel better naturally. And so there's that mismatch in terms of expectations the next time you get sick. So sinus infections, colds, many ear infections are often caused by viruses.
And so you really shouldn't have an antibiotic.
No.
I think there is confusion over that.
Right.
Okay, so the bacterial infections that would be appropriate for the antibiotic. Give us some examples of what.
Well, some ear infections are caused by bacteria.
Okay.
Sometimes that's hard to tell. For example, in the first several days of an ear infection, a pediatrician might choose to observe and see which direction it goes before prescribing. Sinus infections are usually caused by viruses, perhaps until you've been sick for 8 or 10 days and worsening. That's often a suggestion that it's bacterial, no longer viral.
Okay, so what is your department, the Tennessee Department of Health, what kind of steps are you taking to improve this ranking that we have that could be very dangerous?
Right. So first of all, we want to make sure that we try and prevent illness in the first place. So we do a lot of work on hand washing, hand hygiene.
Don't get sick in the first place.
That's right. And encouraging influenza vaccines for everybody 6 months and older who doesn't have a medical reason not to get one, plus pneumonia vaccines for individuals at a certain age for whom they're recommended. Beyond that, we track antibiotic-resistant organisms. There are a number of organisms that are reportable by healthcare providers and laboratories so that we can see the trends that are happening in Tennessee. Is it getting worse? Is it getting better? Are our efforts making any difference? We're also working with partners across the state on what's called antibiotic stewardship. So it's education and a commitment from people to try and prescribe the right drug at the right dose for the right duration of time. So really a range of activities that are ongoing to try to improve this in Tennessee.
Do you think that people, it is sort of a two-way street, not just the doctors prescribing these drugs, but the patients? It's almost incumbent upon, you know, the parents and adults, patients, to really monitor and know when it's time to get to the doctor. Don't wait till you're so desperately sick to go in to see your doctor.
That's right. But then to ask appropriate questions like, do you think I have a bacterial infection? Is an antibiotic going to help me? And don't, if your provider makes the decision that yes, you do have a bacterial infection and could use an antibiotic, it's best not to ask for a particular brand of antibiotic. What you've been given in the past for a different infection may not be the appropriate antibiotic for your given circumstances. So best to ask questions and have a two-way dialogue so that your provider understands that you're an informed consumer and makes a decision together about what's the best treatment for you.
Okay, where can folks go to get more specific information, to really read through some material and learn more about this so they feel more empowered?
Right. So the Centers for Disease Control nationally has a big push that's been ongoing for a number of years called Get Smart. Its aim is both to educate healthcare consumers as well as providers about the appropriate use of antibiotics. There's also been national attention. There's been funds directed towards all the states to try and track antibiotic-resistant organisms, and those things can be found through the Centers for Disease Control website as well.
All right, and when you say wash your hands, just good old soap and water works just as well, right?
So in healthcare settings, the primary recommendation in most situations is for alcohol-based hand sanitizers, but there's nothing wrong with good old soap and water.
All right, okay, can't wash your hands enough.
And I think the other thing that's helpful to think about this, particularly during cold and flu season, is to try not to touch your face, eyes, and mouth.
Yeah, that's key. All right, thank you, Dr. Talley. Appreciate your
having me.
time. All right, and we'll be back with more right after this. Stay with us.